Good morning, everyone. Thank you for joining us for today's webinar on health savings accounts and what employers and employees need to know. My name is Laura Bibb. I'm one of the benefits attorneys, one of two benefits attorneys here at ProBenefits, and I'm joined by my colleague John Cobble. And our topic today again is about HSAs. And we hope this will be of assistance to employers who are perhaps looking to implement HSAs at your next renewal, or if you already have HSAs, as a reminder of the compliance requirements and updates for next year for 2020 as far as the deductibles and out-of-pockets and contributions are concerned. Just a few housekeeping matters. As always, this presentation is being recorded, and we will provide you with a copy of the slides and the recording in the next couple of days if that would be helpful to share with your colleagues. We will take your questions at the end. There are two ways to submit your questions. You can either submit them in the question box on the control panel, or you can email them to us at compliance@probenefits.com. Again, that's compliance@probenefits.com. So today we're going to talk about HSA eligibility, contributions, and some distribution basics. We're going to walk through some plan design examples. John's going to share those with us. And then we're going to talk a little bit about our account administration, and then again answer any questions that you may have that come up in the session or that you have generally about HSAs. An update from our team, as you have, if you're a ProBenefits client, if we are working with you for admin lines of service, this is not news to you, but for those of you who aren't working with us, this may be new to you. We have recently transitioned to a new administrative system. We're very excited about it. We've received great feedback. It's really the best that there is out there. We've got a new employer and employee portal that make the administration seamless and smooth and efficient for everyone. One of the great new features is a new mobile app, which is really cool. If you've not had a chance to use your mobile app yet, I highly recommend that you check it out. It's very neat, a great tool. And if you're not working with us, we'd love to be able to talk to you about this new system. This HSA webinar is part of our 2019 webinar series. We have recently recorded webinars on our new admin system if you'd like more information about that and other compliance topics. Our last webinar series was about 5,500. So lots of resources out there to help you, in addition to the compliance support that we provide for employers and advisors working with us, both as far as your admin lines, as well as 5,500s and WRAP SPD preparation. So health savings accounts, these are accounts that some employers have already implemented, but they are trust or custodial accounts that employees use to pay for eligible medical expenses. These are our we often refer to them in the benefits world as the 213D expenses, the expenses allowed by the IRS to be reimbursed on a pre-tax basis. One of the great things about being a custodial account is that the contributions that an employee makes to their HSA, whether it's their own money or perhaps there's an employer contribution component, are all tax-free, and that includes the growth and the distributions. So an employee can really use this account as a way to pay for current medical expenses or to save for future medical expenses down the road. One of the unique features, of many features about an HSA account that's a little different from some of our other accounts, HRAs and FSAs, is that the HSA isn't an individual account. It belongs to the participant and it goes with the participant. It's not a COBRA eligible benefit. If the employee moves from one job to another, the account goes with the employee. There are rules about contributions. Once they go into the account, they are generally non-forfeitable. There are certain situations if there's clear evidence of error, but we have to look at that on a case-by-case basis, where contributions made in error could be recouped from the account. Employers don't have to participate, so it could be funded solely by the employee, but the employer can make contributions as well if that's how the employer wants to structure their benefits. And there are certain compliance responsibilities that are involved with these HSA accounts. We're going to talk about that in a little bit. But now I'm going to turn it over to John, and he's going to walk us through the eligibility requirements.
Thanks, Laura. So on the eligibility requirements, one of the questions that we often get with the popularity of HSAs is whether anybody can participate. It is relatively open, but there are, as the slides will show here, some eligibility restrictions on how they can participate. The most important one, point 2 there, you'll see the individual must be covered under a qualified high deductible health plan, most commonly abbreviated as an HDHP. And those high deductible health plans have both minimum deductible requirements and maximum out-of-pocket limits in order for them to be eligible for the employee or the individual to participate. We're having this conversation in 2019, but the limits are going to change for 2020. And so if you are not a calendar year plan, if you have a fiscal year benefit plan, then you may want to consider making sure that the deductible minimums meet the 2020 standards as well as the 2019 standards in order for your employees to be eligible. You'll see there the 2020 minimum deductible is going to go up to $1,400 for an individual and $2,800 for a family. That's up, I believe, about $50 from last year on the individual, and I think $100 on the family. And then the out-of-pocket maximums have also increased a little bit there, $6,900 for individual and $13,800 for family. The eligible, you'll see there, eligible individuals does include owners of entities, so they are allowed to participate as well, whereas other benefits may be restricted to owner or against owner participation. But you'll also see that Medicare recipients are not eligible. And one of the functions that we provide there is to notify you of any of your employees who are turning 65 in the coming year. Turning 65 does not disqualify you from participation. It's the Medicare recipient. So that's why there's a note there to watch out for retroactive enrollment there, because it does go back to that, but simply turning 65 does not disqualify you. Additionally, you'll notice that no first dollar coverage is allowed under that deductible. So, for example, you'll see a few there, a general purpose FSA, essentially the medical side of FSAs, restrict HSA participation. Certain HRAs, if the HRA pays the benefits on the first dollar, and we'll look at a couple of these in our examples later, that HRA would disqualify HSA participation. And then, of course, as we mentioned before, coverage under a non-high deductible health plan would prevent somebody from participating in an HSA, as well as certain VA benefits, though we've noted there recent guidance has opened up veterans participation under certain circumstances. I would encourage you to speak with your account manager on this. We can help review that on a case-by-case basis to cover those. You'll notice there the coverage does include spouse coverage there, and then adding an HSA from an FSA plan that has carryover or a grace plan may also affect that eligibility. So again, your account manager can help with that in a transition from one type of benefit to another. You'll notice here that eligibility for a non-high deductible health plan does not cause it, only enrollment. So if your company is one that offers multiple insurance options, Just because someone is eligible for like a PPO plan, for example, does not mean that they are not eligible. Only if they enroll in that other plan would they be disqualified at that point. And then there are other options as well to provide additional coverage and still maintain HSA eligibility, such as the limited purpose, which sometimes called the dental vision FSA, as well as a post-deductible HRA. We'll go into some of those when we look at the plan designs a little later. Laura is going to talk now about contributions.
So if you have someone who is HSA eligible, they've met those requirements that John just went over, they don't have any disqualifying coverage, then the individual can contribute to an HSA account, that an individual bank account. And the IRS has recently released the 2020 contribution limits. You can see them here, $3,550 if the individual has self-only coverage, and $7,100 if the individual has family coverage. There's also a catch-up contribution of $1,000 once an individual reaches the age of 55 or older. They can make the annual contribution limits above and an additional $1,000. So that $1,000 is in addition to the annual contribution limits listed here. The contribution limit, as well as HSA eligibility, is determined monthly. There is one exception to this. This is the full contribution rule. This allows a participant who is HSA eligible on 12/1 of a calendar year, so they're enrolled in that qualified high deductible plan, to make a full year's HSA contribution. So for instance, if they're on 12/1, if they're enrolled in self-only coverage, but they've not previously been enrolled in any high deductible health plan, they could make the full $3,550 contribution. The caveat is that they have to remain HSA eligible. They have to remain enrolled in a qualified high deductible plan for the following calendar year, so for the following 12 months. If they don't, then there are tax consequences associated with those contributions outside of the month of December. There are two approaches for employer contributions to an HSA. The contributions can either be made inside the Section 125 plan or outside the Section 125 plan. The difference here is whether employees are allowed to pre-tax their HSA contributions. If they are allowed to pre-tax, then the contributions are considered to be inside the Section 125 plan. And in that case, the discrimination testing rules that apply to the 125 plan are going to kick in, and that benefit must be identified in the flexible benefit plan, the Section 125 plan SPD. So in your SPD, that HSA contribution should be listed. And if you're working with us for your Section 125 plan and you have an HSA, that benefit is listed. If employees are not allowed to pre-tax their contributions, then the HSA is considered to be outside of the Section 125 plan. And then there are comparability rules that will apply to the contributions that set some parameters on how you can contribute for all of your employees. So you couldn't contribute one way for one employee and another way for everyone else. There are ways that you can classify employees, but generally the contributions are going to have to be comparable. And I will say that we mentioned that owners can participate in the HSA, unlike an FSA. But if the owner is prohibited from participating in the flexible benefit plan, they would need to make their contributions to the HSA on a post-tax basis. So in that instance, they would contribute on a post-tax basis and claim their contributions as a deduction on their taxes. And now John's going to walk us through the HSA distributions.
So a lot of questions come up about distributions, and I think that a lot of folks have these questions based on their experience with an FSA. As you may know, if you've ever participated or your company offers an FSA, FSAs are restricted to the year in which the expense is incurred. With an HSA, as long as it is a qualified medical expense that was incurred from the time of the HSA establishment, so whenever you started participating in the HSA, you can then claim that expense later. So a lot of suggestions that some folks do is they save up those expenses for the end of the year so that the HSA grows, and then submit their expenses against the HSA and claim them that way. You can also wait and claim something in a later year, unlike in an FSA where you are restricted to the year in which it was incurred, um, accepting any run-out period that's available there. So the benefits of the HSA distributions, you'll notice there that it is tax-free for qualified medical expenses. As Laura mentioned early on, the three tax benefits of the HSA are that it can be tax-free, or it is tax-free when you put it in, it's tax-free when it grows, and it's tax-free when you bring it out for a qualified expense. So that's really saving the participant a lot on being able to use the HSA. And you can also pull the money out for a non-qualified expense. You just have to note that when you do that, and of course pay the taxes. And there's also a penalty, tax penalty for doing that. So you would not want to unless you really had to, but you are allowed to do that by the IRS as well. As I mentioned earlier, you'll see the timing of expenses. As long as you were established in an HSA, any expense from that point, and your HSA continues, any expense from there would be eligible. So you're not restricted to the year. And again, there's no limit on when the distribution occurs. So you can pay for expenses that you incurred last year. Maybe your HSA wasn't as full last year as it is this year, and this year you don't have expenses, so you could go back and pay for those expenses that you incurred at that point. Or if you get down the road a few years and you don't have the medical expenses you expected to incur, you could then go back and pay some of these old bills with your tax-free money there that's been growing through the HSA. So that's really the benefit, is not having to guess at your medical expenses for the year in order to cover them under the tax-free benefit. You can wait and cover them later. There are some reporting requirements. I'm going to let Laura speak to those, and as she will mention too, we at ProBenefits, we will help with the necessary reporting requirements and making sure the paperwork comes through. Laura.
Thanks, John. And what would an employee benefit be if we didn't have some compliance obligations associated with it? Thankfully, some of these are things that as an employer you're already doing, so it's just an extra step. And then other obligations are on the actual participant and the account custodian. But there are three categories of reporting requirements for the HSA. We'll go through those. The first is employer reporting. So if you have an HSA for your employees, the employer has to include the employer contributions and employee contributions made through the Section 125 plan. So any pre-tax contributions that the employee is making on the W-2, and that's reported in Box 12, Code W. There are also account holder reporting requirements. So this is the participant who has the account or who owns the account. The reporting requirement here is Form 8889. This is a tax form where the account holder is reporting any contributions and distributions that have been made for the year. And this is done by filing that form as an attachment to their 1040 when filing the individual taxes. And John mentioned that you can use the HSA for non-qualified expenses. So if that big screen TV or new boat is calling your name and you decide to take it out of your HSA, you would have to report that, as John mentioned, and there are tax penalties associated with that. That is reported on this Form 8889. There are also trustee custodian reporting requirements. These are reporting that the account holder is responsible, or not, excuse me, not the account holder, the bank or the financial institution where your HSA is located. The first is 5498. This is the report that provides information on account contributions for the year and the fair market value of the HSA as of the last day of the year. And this reporting requirement is actually due after the tax season occurs. So many of you, if you already have HSA accounts, you may have received this form. And typically we see them come out in May, so you just need to hold on to it. But that is one of the reporting requirements for the custodian. The second is Form 1099-SA. And this is a report of the account distributions that have been made. This is actually filed with the IRS, and a copy is provided to the participants. So if you have an HSA account, you would have received this form in time for you to complete your taxes. So your CPA, or if you're doing your taxes yourself, this is a form that's asked about as part of the tax preparation process. So now we're going to look at some plan design examples, and John's going to share with us 2 examples of HSA plan design.
Thanks, Laura. So in the first plan design example here, you'll notice the first bullet point there is that flexibility. A lot of what the HSA gives you is the ability, as long as you meet the minimum standards there that we'd mentioned earlier on, the HSA gives you the opportunity to work it around and through a separate HRA. So in this example, you'll notice that the HRA has to reimburse a portion of the deductible or out-of-pocket expenses after that minimum is met. So the minimum $1,400 for individual or $2,800 for family benefit keeps the employee HSA eligible so that they can participate in the HSA, but then also use funds provided by the employer's HRA. And in this example, we've got a qualified high deductible health plan, and the participant meets that minimum deductible, and so then the HRA can reimburse the last portion of that deductible. For an individual, in this case, it would be $2,100 or $4,200 for the family. And that maintains the HSA eligibility for the employee so that they can contribute there. And then you can see they can also replace employer contributions to the HSA, as well as the employer maintains control compared to the HSA contributions. So the benefit works equally for that employee. But then as long as that HRA is linked to the enrollment in the high deductible health plan, then that participant or that employee can meet both requirements and still participate in both benefits. In our second example, this is incorporating the limited purpose FSA, which is one thing that a question that comes up a lot, and Laura touched on earlier in the presentation, but bears repeating, that the HSA can serve as a benefit for medical, dental, or vision expenses. Sometimes folks are confused about that and think that they can only use the HSA for their medical expenses, but it in fact is a replacement vehicle for a full FSA, but you can also use it in conjunction with the limited FSA, and that FSA would be limited to dental and vision expenses only, but then allow the employee to still save in the HSA for their medical expenses, or if they had an expense that exceeded their limited FSA, they could then use the HSA to supplement that. But you'll see in this example here, again, the HRA will use the standard 35,000 qualified plan, and the participant is still required to meet that minimum deductible of $1,400 or $2,800 for family, and the HRA is going to reimburse the same amount there, the $2,100 or the $4,200 of the deductible. But then they also, in addition to maintaining their HSA eligibility, they can use the limited FSA for those dental and vision expenses and keep their HSA money reserved for other things that they need. And that just gives them some flexibility to use the benefits where it most benefits them and where their needs are throughout the plan year. Again, the limited FSA would still have the FSA restriction of being within that plan year, but that's where the HSA could supplement the FSA for expenses like orthodontia is a great example that probably exceeds the single year benefit of an FSA, but would the HSA could supplement and be used to fund the rest of that orthodontia expense.
Thanks, John. So one of the things we do at ProBenefits, in addition to the other administrative lines that we work with our employer groups with, is help administer HSA. So we can help you communicate this benefit. It is a little different, as you've seen today, than some of the traditional plans that employees are used to. So communication is key to help them understanding it. We can also help you make sure that you've got an IRS compliant solution for pre-taxing employee contributions to the HSA. Additionally, as John has gone through these examples, you've seen that there are ways to set up HRAs and FSAs that are compatible with the HSA and really maximize employer dollars and employee dollars, giving the most benefit that we can to the participants, whether that's HRA dollars or FSA dollars. We'd love to help you set that up and talk to you about how you can do that and maximize those benefits as well. Another great reason for using ProBenefits is that we are an independent administrator. So some employers have used their insurance carriers for HSA administration or HSA as their HSA custodian for those accounts. However, if you decide to part ways with that insurance carrier, you're also left with having to change the HSA administrator. And by being an independent administrator, you can set up and make changes to your underlying insurance plans without having to go through changing the administrator or the custodian of your account. We also have trained staff, both Jason and I, the two attorneys here can help you with any questions regarding the legal requirements, as well as John. And then our entire staff is experienced with HSAs and the nuances that apply to HSAs. So just a little bit about us for those of you who aren't working with us, or a reminder for those of you who are of all the things that we can help you with. This slide just provides a little bit information about ProBenefits and what we do. Again, I would urge you, if you haven't talked to us about our new platform, to do so. It is a great tool, great resource for employers and employees, and just really adds to our overall administration for HSAs and all of our other administrative lines. And now is the time for question and answer. And again, you can submit those questions on the question box on the control panel, or you can email them to us. Our email address is here, compliance@probenefits.com. We will stay on the line for just a little bit longer to try to answer some of your questions that you may have. But if you have to jump off, or if you're listening to this recording, you can always email us at compliance@probenefits.com. And we'd like to thank you for joining us today. We appreciate your time, and we hope you will join us for future webinar series.